Good evening, everyone, and welcome to the next series of the presentation for the webinar. This one is titled Substance Use, Understanding Barriers, Prevention, and Treatment Options. My name is Chelsea Clark, and I am the Assistant Director at Conewago, Indiana, one of the facilities within the Friar Tree Company. So addiction involves craving something intensely, the lost control over use, and continue involvement with it despite adverse consequences. Addiction is a complex brain disease that causes the inability to stop using a substance or engaging in a behavior, even though it's causing psychological and physical harm. Addiction causes a person to struggle to control their behaviors, have strong cravings, have difficulty controlling their emotions, and the inability to abstain from using. People can become addicted to a variety of things, to include alcohol, drugs, shopping, food, sex, pornography, video games, and gambling. Nearly 23 million Americans, that's almost 1 in 10, are addicted to alcohol or other drugs. More than 2/3 of people with addiction abuse issues abuse alcohol. And the top 3 drugs causing addiction are marijuana, opioids, and cocaine. Addiction is now understood to be a brain disease, whether it's alcohol, prescription pain pills, nicotine, or gambling. Overcoming addiction isn't as simple as just stopping or exercising greater control over impulses. This is what is impacted when you hear about reward systems or pathways. One of the most significant parts of the brain is the reward system, and this is developed as a way to reinforce behaviors when we need to survive, such as eating. So when we eat foods, the reward pathways activates a chemical called dopamine, which in turn releases a jolt of satisfaction. This encourages you to eat again in the future. When a person develops an addiction to a substance, it causes the brain has started to change. This happens because addictive substances trigger an outside response when they reach the brain. Instead of a simple, pleasurable surge of dopamine, many drugs of abuse, such as opioids, cocaine, or nicotine, cause dopamine to flood the reward pathway 10 times more than a natural reward. This happens because addiction develops when the pleasure circuits in the brain get overwhelmed in a way that can become chronic and sometimes even permanent. Identifying triggers starts with knowing yourself and who you are as an individual. Triggers are thoughts, feelings, and memories that remind you of your substance use or the lifestyle around your substance use. Brain scans have shown that these triggers are tied to your neurochemistry, which is activating the key parts of your brain that lead to the desire to use. These triggers can be different for everyone, though. Depending on your own personality and your substance use history, the following things may trigger a craving, such as special occasions or holidays, parties, sporting events, gambling, be around people you associate with who use substances, being offered to drink or use a substance, being fatigued, stressed out, free time or boredom, watching a movie where someone is using your drug of choice, or loneliness. The vast majority of people who need treatment for substance use disorders do not seek it. Several barriers can discourage someone from getting help, and many people are deterred by a combination of factors. But there is no good reason an individual in addiction should avoid treatment. More than 20 million people battling addiction require treatment to recover. Some people can quit using alcohol or other drugs with the help of family or friends. However, some people with substance use disorders may need professional assistance. For those individuals, addiction may become too severe, or they're genetically predisposed in a way that makes it nearly impossible for them to quit without professional rehabilitation. Getting help for addiction is not easy. Withdrawal symptoms and cravings can discourage people from trying to quit. Many parts of society condemn trying drugs, leading many people to hide their addiction. The National Survey on Drug Use and Health found that 39% of individuals could not afford it or did not have health insurance. 29% of people were not ready to stop using drugs. 18% feared a negative opinion from neighbors or the community. 17% feared it would affect their work or their job. 14% did not know where to find help. And lastly, 8% of individuals did not think they needed help. Sometimes people choose not to seek treatment for a number of reasons. For example, they may be afraid to tell their boss for a fear of a negative reaction, and they think they can't miss work or afford treatment in the first place. Decades of research supports themes for avoiding treatment to include cost, denial, the stigma, work and lack of awareness or knowledge. Psychological characteristics, lifestyles, environmental factors all contribute to these excuses. The disease of substance use disorder currently ails over 21 million individuals in the United States. These are not just people you see on the streets. These are not just the bad group of kids at school. Oftentimes, these are everyday people battling a chronic drug or alcohol addiction. These are people that, in many cases, do not realize they even need help. Someone you work with may be enduring an alcohol problem. Your teen's friend may be masking a drug addiction. Maybe you are here because you're someone you love is stuck within the cycle as well. Each year, an estimated 20 or 90% of addicted persons do not seek professional help. It's a very unfortunate reality for us to face. With all the addiction present in today's society, we have to ask ourselves why these individuals are not getting the help they deserve. Why exactly and what exactly is preventing our loved ones, our family, our friends, and neighbors from seeking proper drug treatment. And there are 6 main barriers to what most prevent people from pursuing addiction treatment. And the majority of people who did not receive treatment did not see a need for it. Despite the negative lifestyle changes, the financial and emotional cost, the damage that addiction bears, these people did not realize that their lives were at stake. They did not recognize the severity of their addiction. Many individuals in addiction can see the need for addiction treatment, but still refuse to attend treatment. In fact, 40% of individuals in addiction do not seek help because they're not ready to stop using. They excuse themselves from the conversation of drug treatment completely by letting addiction control their priorities. Addiction controls their lives. Many people, from students to full-time professionals, do not seek help because they do not want to take time away from the other responsibilities. Students, in some cases, and their parents are worried about the negative impact a long-term leave may have on their academics. Full-time workers may feel like they cannot afford to take time off from their job. Long-term drug treatment may take 90+ days, but addiction can take someone's life. It's important that we do not let our loved ones lose sight of what matters, and that's them. Addiction is undoubtedly, it carries a stigma, and this stigma carries a heavy weight on the shoulder of those in and out of recovery. So much so that many people do not want to seek addiction treatment out of fear of judgment from others. They do not want to stand out, but rather to be healthy and move forward in life. Unfortunately, this stigma prevents 10% of people from moving past addiction completely. Within the addiction cycle, it can be hard to know where to look for help. Individuals who use may feel hopeless or unsure if anyone can help them at all. They may not feel the need to do the research in finding the right drug treatment facility for them. But even when they do, they may live too far away from a quality treatment provider or not have a way to get to and from treatment. They may not fully understand all of their treatment options, deterring them from seeking proper health treatment. There are too many people out there today suffering from addiction, too many youth impacted by the early onset of substance abuse, for us just to stand by and let it happen. Like anyone suffering from a disease, these individuals suffering need our help. They need help evaluating their treatment options, and they need someone to support this courageous decision they're about to face. Women are more likely than men to face multiple barriers when accessing substance abuse treatment, and they're less likely to seek treatment in comparison to men. Women also tend to seek care in mental health or primary care settings rather than these specialized treatment programs, which contributes to poor treatment outcomes. When gender differences in treatment outcomes are reported, women tend to fare better than men. Women are more likely than men to encounter barriers that prevent them from seeking or following through with treatment overall. Women are more likely to experience economic barriers to treatment, and women are really more likely to have difficulty attending regular treatment sessions because of their family responsibilities. Providing comprehension services such as housing, transportation, education, income support reduces post-treatment substance use among both men and women, but greater numbers of women need more services. Women are more likely to report feeling shame or embarrassment because they're in substance abuse treatment. Anxiety or depressive disorders, which tend to be more prevalent and severe among women, may prevent women from seeking help with substance abuse issues. Seeking treatment for substance use disorder is a big step. However, it does not guarantee that the fight is over. You might still practice what you learn in treatment, and substance abuse starts when someone uses any drug or alcohol for recreation purposes. This means you can suffer from addiction to prescription medications, as many Americans do today. Substance abuse also begins when you drink to drunkenness or use drugs for intoxication exclusively. Of course, any abuse of prescription medication is a big red flag and risk for addiction. You need healthy friends and relationships in your life, not toxic ones. If you need to write down some quick excuses to avoid people and places that trigger or tempt you, do so. Someone can also memorize those excuses and use them. This is to protect yourself. Mental health and addiction often accompany one another. Anxiety, PTSD, ADHD, depression, and other mental health conditions require professional help and support. Professionals should be utilized to help one learn coping skills in the prevention of substance use. Do you have a family history of substance use, mental health concerns, or addiction? For example, research indicates addiction runs in families, but it can be prevented. So know those risk factors for substance abuse in your life and guard against them. There are different treatment options that different providers, so for inpatient, halfway house, or outpatient providers, offer within their treatment settings. There's cognitive behavioral therapy, motivational interviewing, group therapy, 12-step programs, or medication-assisted treatment. So cognitive behavioral therapy, or CBT, helps people to develop an alternative way of thinking and behaving, which aims to reduce their psychological distress. Motivational interviewing is when we utilize a client-centered approach to help those individuals who may be struggling with those mixed feelings about changing their behavior. So this is when they're more likely to be externally motivated, and we want to use that motivational interviewing to change those feelings and make them internally motivated. Group therapy is a type of psychotherapy that is generally centered around a particular topic. And within Firetree ourselves, we offer a variety of different group therapies to include positive thinking, cognitive behavioral therapy, co-occurring, life skills, substance abuse education, and the list goes on. There's also 12-step programs. This could be Narcotics Anonymous or Alcoholics Anonymous. And these programs are designed for people to help one another achieve and maintain recovery from drugs or alcohol. And medication-assisted treatment, and this is when we use medications in conjunction with counseling to create a holistic approach to treat substance use disorders. So within Firetree, we have a variety of different programs. We have residential treatment, so that's inpatient treatment. We have halfway houses, we have outpatient treatment, and we have residential reentry programs. So the vast amount of programs within Firetree itself. So family support as an intervention strategy. Family members are often desperately concerned about their loved one's drug or alcohol use, but don't know how to begin that conversation. For many people struggling with addiction, They're often motivated to seek treatment by the care and concern for their loved ones. So it's really important as that family member to just be supportive and be non-judgmental. Be very specific when you're talking about that individual's behavioral patterns that you've been observing, and be prepared to offer help. Substance use affects everyone in the family. So it's so important that family members are involved in the treatment and the recovery process for both adults and youth. Most patients engage in treatment because they have that positive family involvement and that intervention. Positive family support and positive supports all around go a long distance with individuals fighting addiction and in recovery. Each family member is affected by the chemically dependent, the individual who's in addiction, as their addiction progresses. And each family member reacts with survival behavior. They often take in that personal stress. However, it's really important to understand and know that relapses do occur and they're part of the recovery process. So do not lose faith in your loved one just because they use again. Support them, understand them, and give them that guidance and direction they may need. You cannot stop anyone from using any more than you can force them to start using. Accept that. Be there for them. That's all you can really do. Your responsibility to yourself takes priority. Taking care of yourself takes priority. You cannot help anyone if you're unable to take care of yourself. You have to continue and put yourself first no matter what. One of the hardest and most important steps may just be starting the conversation. By no means do you have to be an expert or have the answers to start that conversation. Express your concerns and don't be afraid to talk about it. Reassure them that you care about them and you are there for them. But also educate yourself. The more you understand about addiction and the recovery process, the better you'll be able to support that loved one. And to wrap this up, I have some resources. I have our Fire Tree website and our phone number available. I have SAMHSA's national hotline and 2 websites, Alcoholics Anonymous or Narcotics Anonymous. I want to thank everyone for joining tonight, and I hope you're back next month for the next presentation. Thank you.